Hello, everybody. You're very welcome to the second exercise, which is called a body scan. And I call this exercise a gym for the mind. Basically, we have 50 thoughts per minute, which is really, in essence, one a second. It can be planning thoughts, worrying thoughts, solution-focused thoughts, and often we get swept away with these thoughts. And particularly in the times that we are experiencing at the moment, we can begin to catastrophize, which is not helpful really to us at all. It's causing us more stress than we really need. So this exercise is attempting to help us recognize when we are being swept away, because this can happen in an instant, and we can be gone for 5 or 10 minutes and not even realize it. So we're developing the ability to recognize when we are swept away, and developing the ability also to return to the present moment, which is in essence what mindfulness is all about. So during this exercise, please don't strive to achieve a particular state. The idea of the exercise is just to be with whatever you're experiencing in the moment. And it's important also to bring an open mind and a sense of curiosity to the exercise. And during the exercise, you might find that your mind wanders 10 times, 20 times, 100 times. And that's perfectly normal. That's what the mind does. If you find this, and as soon as you become aware that your mind has wandered, very gently but firmly bring it back to either your breath or the sound of my voice or the part of the body that we are exploring at that time. So now what I'd like you to do, if you can, is to find yourself a comfortable spot, say for the next 15 minutes, where you're not going to be disturbed, and maybe perhaps if you can have some loose clothing or wearing something where your breathing isn't going to be restricted. And so you can lie on a mat or a rug, or you can sit. And I want you to feel yourself on that chair or on the mat or on that rug. So feel your body being supported by the chair or the mat or the rug. And I'd like you to bring your attention to your breath. Where it's coming into the body, is that through the mouth or the nose? And out through the mouth or the nose. So just taking a few breaths in and out. So I'd like you to bring your attention down your left leg, right down to your foot, your left foot. Bringing your attention to your toes of your left foot, your big toe right down to your little toe. There's no need to move them. You're just bringing your attention to your left foot, the toes, the instep, the sole of your foot, and around the ankle. And just see if you can experience some sensations there. Are they hot, cold, itchy, sore? And if you're experiencing nothing at all, that is fine too. That is your experience in this moment. So bringing your attention to your foot and being curious about this piece of equipment of your body. And now when you're ready, bringing your attention up to the calf and the front of the leg. So very gently bringing your attention to this part of the body, to that fleshy part at the back of your leg, and the rather bonier part to the front of your leg. So bringing your attention to this part of the body. What does this feel like? How is this today? Any sensations? And if none, that's fine, but you're just bringing your attention to this part of the body. And then we're moving on up to the knee. This joint that serves us so well every day. So the back of the knee, the sides of the knee, and the kneecap itself. Any pain, any tension, any sensations at all. So bringing your attention to your knee, if you can bring your full attention to your knee, and if you find your mind has wandered, just gently but firmly bring it back to the part of the body that we are exploring at the moment. And then moving on up the leg, up to the thigh, the front of the thigh and the back of the thigh, where it's making a connection with the seat, the ground. So how is it? Maybe just comparing it to the other thigh. Is there any difference between the two as you sit here or lie here? So bringing your attention to the thigh, the front part of the thigh and the back of the thigh, and looking for any sensations that you might be experiencing. And now bringing your attention up to your hip, and perhaps noticing how the thigh connects with the knee and the hip, even noticing these joints and how the bones all fit together. So bringing yourself and your attention to the left side of your hip. Anything, any sensations there? And again, if there's no sensations, this is fine. This is absolutely fine. And before we move across to the right side of the leg, if we can imagine taking a deep breath in, right in, down the back and down the legs, right into the toes. And imagining that breath coming right back up the leg and up right into the lungs and out through the mouth. Very good. So moving across the body and into the right side of the hip. Any sensations here? This hip that's connected to the thigh. Moving down into the right leg and the thigh of the right leg, the front of the thigh, the back of the thigh. Any sensations at all here? Being curious about how the thigh fits into the knee and the knee socket, the front of the knee, the sides of the knee on the right leg, the back of the knee. So trying to bring your attention to this part of the body, exploring any sensations that you might be experiencing in this moment. And if there's no sensations, that's absolutely fine. That is your experience in this moment. And if your mind has wandered and you recognize that it has wandered, gently and firmly bring it back to the knee on the right leg. And then moving further down into the calf muscles on the front of the right knee. Again, that fleshy part at the back of the leg, that bony part to the front. And exploring any sensations here in this area. And being curious about how this part of the leg slots into the ankle joint and continues on into the foot, the front of the foot, toes, big toe, right down to the little toe, the nails on each toe, the space in between the toes. So bringing our attention to this part of the foot And again, maybe if we can imagine taking a deep breath in, right down the back and into the right leg and down into the toes. And breathing back out. Well done. So now maybe bringing our attention to the lower back. Quite often we can carry a lot of tension around this area. So bringing our attention to the lower back and the spine, or literally our backbone, and maybe bringing our attention to this area to see if there's any strains, any sensations. Is it cold or warm, itchy? Any sensations at all, and trying to bring our attention to see what kind of sensations we are experiencing right now in that area of our body. And moving on up the spine, to the middle part of the spine, the torso, and just checking in there to see what's happening in this part of the body at this moment today. So checking in, is there any tension, any pain, any discomfort, any ease? And again, if there's no sensations, this is absolutely fine too. Again, then moving on up into the upper back and the neck region and the shoulders. And again, often an area where we can store a lot of our stress, which can manifest in tightening of the shoulders or pain across the shoulders. So checking in with this part of the body, no need to move it at all, just checking in, the right shoulder, the left shoulder, any tension. And maybe just taking a nice deep breath in and imagining it going down into the shoulders and down the back and into the hips. And breathing out. Well done. And perhaps we'll explore both arms together. So we're going to go down the right arm and the left arm, the upper arms, checking in with the left elbow, the right elbow, this bony part of the outside of the elbows and the fleshy part on the inside. So checking in with this joint and these joints to see if there are any sensations there. Are they similar? Are they the same? I'm moving on down into the lower part of the arms and the wrists. And maybe being a bit curious about how this part of the arm fits into the elbow joint and then into the wrists and continues on down into the hands and down into the fingers and the thumbs. Bringing your attention to this part of the body as much as you can. So what kind of experience are you feeling there? Are your fists clenched, perhaps? And you might want to loosen that tension if you can. So bringing your attention, are they warm? Are they a little bit sweaty? Maybe there's some moisture there. Bringing your attention to the fingers and the nails, the space in between your fingers. Are they the same or are they different? Maybe trying to pick out what the differences are. And maybe now you can take a deep breath in and imagine that breath going right down into your arms and right down into your fingers. And the breath coming right back up your arms and coming back out through your mouth. And now bringing your attention to your neck, where it attaches onto the spine and the top of your shoulders, and how it's attached to the head. Maybe bringing your attention to the jaw And if there's any tension here, we can hold an extraordinary amount of tension in our jaw. So bringing our attention to this part of the body, checking in to see if there's any tension or any sensations at all. And again, if you're experiencing no sensations, this is perfectly fine. And if you find that your mind has wandered again, gently and firmly bring it back to the sound of my voice or to the part of the body that we are exploring. And we're moving up into the face, up into the cheeks, the nose, the mouth, the tongue, the roof of your mouth, your teeth, up into the eyes. I've been just thinking about the eye sockets and the moisture in your eyes that allows your eyes to move freely. Your forehead, the top of your head. Bringing your attention to this area. Being curious about how it interacts with the rest of your body. Allowing food to travel down the throat and into your body, and allowing air to travel in through your nose down to the lungs. So bringing a sense of curiosity about your whole body in general. And perhaps now, just before we come to the end of the exercise, thinking of your body as a whole and taking a breath in and imagining that breath going right down through your spine and into your hips, down to your legs, right into your toes, down your arms and into your fingers. So taking a nice deep breath and letting that breath out. And taking another breath in, imagining it traveling right down through the body. So now maybe perhaps opening your eyes if you've had them closed, bringing your attention back into the room very gently and maybe starting to move your toes and your feet and your hands and your arms very gently, bringing yourself back into the room. And if you're lying down, maybe just rolling to your side and very gently pushing yourself up into a sitting position. So well done, and congratulations for taking this time to yourself. It's very important to mind ourselves in these really challenging times. And hopefully we'll get to see each other very, very soon.